Medic 30 Medical Emergency 2316 West Main Street, 42-year-old patient, general weakness for 30 minutes, dispatched 12:03.
First of all, let's make sure we check behind their knees and check their calves.
30 update on your patient.
Medical emergency.
Patients is reluctant. 911 to come check them out.
Could be a house, could be commercial residence.
Weakness, 42-year-old.
Weakness. It doesn't indicate any sort of trauma, but I mean weakness could have failed, so you have to immobilize. You know, make sure you have
take everything we would last time: ALS, BLS bag, cardiac monitor, so stretcher and suction.
Yeah, if we're upstairs, my big stair chair with us.
I guess we would try contacting dispatch, see if they had any information about whether we needed to use PPE or type of building or any of that information, if they could give us that. Wear N95. Just prepare goggles, N95.
Yep.
Gloves already. Any information from dispatch or just what we got?
What you got? You can request information if you want.
From dispatch? Okay, yeah, so we would call back and ask what kind of building it is. Is it a residence? Is it a business? Or
possible COVID?
Yeah, possible COVID.
Any call history?
Dispatch Medic 30. Occupancy appears to be a business. Katie's Auto Shop. No PPE required per call taker.
PPE is required?
No CPPE required.
I would take it anyway. Generalized weakness, auto shop. It could be carbon monoxide. It could be fuel. It could be any kind of inhalation, anything like that.
Yeah, big thing. Consider burns.
Yeah, but still medical, diabetic, all that kind of things.
Right.
Okay, we're on scene. We're going to take, again, we talked about our stretcher, ALS bag, BLS bag, cardiac monitor, suction unit, and we are going to wear our PPE, N95 and goggles and gloves, obviously, just for precautionary measures.
Any suspicion the scene would not be safe?
Did we see anything on the windshield survey? Nothing abnormal? Okay.
You said you smell urban air and nothing atypical.
Urban air is just like stinky air.
Like in the city.
Gotcha. Okay.
You good to go to the patient?
Yeah.
Yeah, I think we're good. Yeah.
Hey guys, how's it going?
Hey man, what's up? How you feeling?
Not well. Katie called for me because I don't want to go to the hospital.
Okay. Well, what's going on?
I just don't feel well.
Okay. All right. Let's check a few things out.
Yeah.
Start looking at some of your vital signs. How long has this been going on for?
On
cardiac monitor, pressure, and pulse ox.
I don't know, like 10 minutes. Katie, how long has this been going on for? You're the one that called.
Yeah, you should have heard him moaning under that car he was working on about his chest. So we finally just called. Probably, I don't know. You guys took about 10 minutes to get here.
Okay, yeah, all right. So
when did
So have you ever had this problem before?
Nah, man.
Do you have any medical history we need to know about?
What do you mean?
Do you take medication daily for anything? You do see a physician for anything?
I mean, I don't take them, but I have what the hell is it called? Matt Foreman.
Okay.
Supposed to take medication for his sugar and watching what he eats, but he doesn't.
Yeah.
Okay. All right. So we noticed sinus on the monitor.
Look. Okay.
So we got sinus.
Lipitor and
Cinepril?
Yeah, that one. For my, I think it's for my blood pressure.
Okay, so we noticed sinus tack on the monitor with the occasional PVCs. Let's go ahead and get them on a little bit of oxygen, see if we can regulate those PVCs a little bit. Want to do nasal cannula, 4 liters?
We'll start a cannula. Let's also run a 12 lead. We don't see any cars or anything like that running that would cause any dangers to the scene.
No, we can't have, once we put them on the jack, we got to turn them off. That's Katie's policy. It's
okay.
Okay, cool. So while you were under the car and started complaining of pain, did the car fall on you? Did anything happen where you had any kind of trauma to the chest?
No. I've been bending down. The catalytic converter was jacked up on the car, so I was bending down.
All right, so okay, cool.
And it
Okay,
just,
so Barrett's going to go ahead and start an IV for you. I'm going to do a quick head to toe assessment. I'm going to go ahead and check his head, make sure we don't notice anything abnormal. Go ahead and do lung sounds.
Did we get the 12 lead?
Yeah, that looks okay other than that receding
Did they
hairline.
give us the 12 lead we asked for?
12 lead, I think it's working.
Oh, okay.
Okay, so chest appears to be
Clear.
normal, looks
Yeah.
symmetrical to me.
did you say lung sounds? You want me to breathe in? Like at
yeah,
the
can you
doctor?
do- yeah, just like at the doctor. We'll do lung sounds.
Like that good?
Yeah, that looks good. But so why you're wincing? Is it hurting somewhere?
No, it's not hurting. It's just, I don't know, you know?
Okay.
Okay, there it is.
All right, so 12 leads running.
I just don't feel right, you know?
Established.
Yep, IV's established.
All right, sir. Are you allergic to anything?
Sulfa, I think it is. Sulfa.
Do you have any recent stomach problems, ulcers, anything of that sort?
I don't go to the doctor, dude. I don't know. I don't think so. I drink
All right, go ahead and
coffee.
before aspirin.
Yeah, he's complaining. Are you have any pain in your chest?
No, I just feel funny. You know, it feels
Okay.
weird.
All
I
right.
think maybe.
What?
But
How's it feel? Can you tell me funny other than funny?
just like you know, like a roller coaster. You go over a roller coaster.
Okay. I
You
wonder
know
if
what I
that's
mean?
complications or something like
Might
that.
be, but can we get a V4R?
Yeah, can you transition that monitor to a V4R real quick? And then also while we're doing that, I'm gonna work on a VGL, see if we can get a sugar since he does have a history of being on metformin.
So that has V4R, correct?
That's your V4R.
Okay.
Okay.
I think we're safe to do nitro. Or just like may have some posterior VGL. You go with
Yeah.
a sublingual
Hey,
nitro.
my hand hurts, man.
Which hands hurt?
Your hand.
My right hand, it feels like I smashed it. You know, like when you smash it with a hammer.
Okay. Yeah. Can
Shouldn't
I
be
take a
having
look
any
at it?
hammers in my shop.
Yeah, you can look
Okay,
at it.
Can I take a look at it?
Yeah, there you go. What do you think?
Do I notice anything abnormal when I look at his hand?
I think so. Looks like my damn hand.
Okay. All right. So we inspected his chest on the front. Can I get an inspection? Finish that rapid trauma or that rapid assessment. We're gonna look at his back.
Nothing.
That looks pretty normal to me. Do I notice anything on the extremities that's abnormal? Palpate, also take that chest. We already got that done.
I don't know. My arms. What do you want? What do you mean? Like what?
Yeah, abdominal assessment. He's had gallbladder problem because of right shoulder pain.
Yeah, it could be referred pain. Yeah. What's happening? Has anything happened in the past couple of days? You know, car wreck, any kind of trauma, any issues over the past couple of days?
Oh man, it's Friday. I'm supposed to be drinking beer this afternoon with my buddies.
Okay.
Did we give the aspirin and nitro?
We haven't. I don't think we've given aspirin nitro. He's not complaining of chest pain. I don't really see anything on his 12 lead. You want to?
You didn't see the depression in,
I saw some depression. You want to get it?
but that could be a posterior MI.
You want to run a posterior?
We run a
Can we
posterior.
run a posterior 12 lead?
15 lead.
So based off of this, then we can determine.
Katie, my hand hurts. I don't feel good.
It's weird. Your
Depression down here.
hand.
Yeah. And then,
I'm thinking he's having a posterior MI. So that's on the front. Then what's on the back? The back would be elevation, drinking behind it, correct?
That's your posterior.
That's the
so
posterior.
this is an actual posterior. This is not the normal.
So he has depression all the way around.
It's hurt, man.
So can we check a pulse in that right arm? He said he's tingling and it's hurting.
Yeah. So compared to this one, it's a little less.
It's a little bit less.
Just take blood pressures in both arms.
All right.
Any
So here's the
changes?
left. I'm gonna put it on my left. So this one's the left.
So
Okay.
I think if I'm not mistaken, the first one was 160, 110.
I feel lightheaded now, man. Katie, I'm not gonna be to work tomorrow.
I don't think you should be at work right now.
All right, if he has opposite blood pressures, then I'm suspecting he may be experiencing some sort of aneurysm.
I don't feel good.
He would need to be a priority transport. He does not need to. Yep.
Yeah. All right, let's go to priority transport. Let him up in, on the
He is
stretcher.
not to get up and walk.
We're
We
going to
lift
assist him.
him. He does not do any exertion. We lift
That's
him.
bad.
So left was 105.50. Okay.
All right, I want to go ahead and
Pass out. My back.
we have fluid. We
Call first responders, get somebody to come
call
in.
first responders.
Yeah, we want to call first responders, get the fire department on the way to come and assist us.
His blood
EMT
pressure,
with the glasses. What's your name?
we need to.
My name's Chris.
Chris, my back hurts, I think.
Your back's hurting?
Yeah, it feels funny.
About I think we should probably do some hypertension management. Is this blood pressure?
Ah,
Are they both low? All
they're
right.
both low, yeah.
All right.
Fluid bolus?
Bolus and fluids.
Yeah, let's do a 250 mil challenge bolus.
My arm is killing me now.
All right. Let's go with fluid. Again, we should be on priority transport.
Yeah.
It's going to be an aneurysm.
So we assisted him onto the stretcher without letting him stand. We did all the work for him. He's secured on the stretcher appropriately. It's going to be a priority transport to the hospital. First responders, if they're on scene, they can drive us to the hospital.
What are we doing?
Yep.
What?
We're gonna take you. We're gonna take you over to the hospital, get you checked out.
Oh no! Don't take me to. No, that shit's
There's
expensive.
the hospital nearby, the community hospital is not great. I wouldn't take anyone there if you want them to live.
No.
Yeah,
Just
what
go
kind of
to
hospital?
University Hospital.
How far is the university?
17 minutes.
How close is community?
It's only 8 minutes away, but I took
Oh,
my
they-
mom when she had a heart attack to university. That's where it
What
good
thing
place
is-
So is it a PCI center?
If he's
That's
dissecting,
it.
we'll need surgery.
Yeah. What the hell's that mean?
If he's
It's with the,
dissecting,
it's with the university. They got all the doctors there.
All right. How about let's contact med control, maybe even
Katie, this hurts, man.
we
Check
might
on
have
services available.
services available.
Oh, man.
So we might have to do some dopamine to maintain blood pressure at a low dose. I don't want to give too high of a kick. I don't want to give too hard of a squeeze.
Yeah.
We need a relative hypotension.
All right, go ahead and contact med control for university. I'm sorry.
Medic 30, this is University Hospital. Go ahead.
Hey, university. This is Medic 30. We got a 42-year-old male patient complaining of weakness. He's got some real tingling in his right arm. Said he hadn't been feeling good for the past 15, 20 minutes. Blood pressures, we did left arm versus right arm. He's complaining of some pain in his mid back. Left arm was 105/50. The right arm was about 15 less at 90/57. We're doing a fluid challenge right now. He did have sinus tach, occasional PVC. He's got him on oxygen, 2 to 4 liters.
With that high flow now.
Yeah, we'll switch that over to high flow non-rebreather right now. We're considering possible aneurysm.
He has depression in
Hurts, man.
V4 on his 12 lead. We've done a left traditional 12 lead, a V4R, and 18 lead. All of them show depression in
Posterior leads.
posterior or the V1 through V4. His blood pressure continues to cycle. It's a little bit lower each time. We do notice a difference between left and right arm. We're given a fluid bolus at present, and we're considering a
Katie.
low dose dopamine if we have to maintain blood pressure starting at 10 mics per kg per minute.
Hurt, man. Chris, my back hurts, man.
That the pressure, the pressure you're giving me now. Which arm is that in?
This 88, is this one we double cycled on the right arm or is it back on left?
Right arm.
Right, so right arm is
Let's
currently
do another left.
88/56. And let's do a left side, left arm pressure.
I'm gonna draw up 25 mics of fentanyl for his pain.
I'm good with, yep.
Okay.
We have fentanyl. It's 100 mics and 2 mLs. I'm drawing up 0.5 mLs.
All right, I'm gonna keep track. So
I'm
we're
not
giving,
going to give until we have another cycle of blood pressure to make sure the blood pressure can tolerate
giving him 50 mics.
Feels
25.
like somebody's hitting my arm with a hammer. It hurts, man.
25 mics to the-
Is there any discoloration to that arm? Blue in color, anything like that?
Oh, it feels kind of like, it feels like funny though. It feels like,
Okay, we still have a.
I don't know. It's weird.
Alright.
It's like no, but when I touch it, I don't really, it feels like pressure. Like I'm touching pressure. I don't really feel, it's weird, man.
Okay. Well, we copy that. If you need to, yeah, treat his blood pressure, but otherwise, then we will we'll be expecting your arrival in about 5 minutes.
Okay, yeah,
All right.
left arm was 111 systolic over 72,
Okay.
856.
All right, is
Copy
anything that's been constricting around his arm? Has anything landed or had his arm trapped or anything recently?
University Hospital.
Have I what?
Thanks, Doc.
Arm?
Sorry, Doc.
No, just this cuff you put on there, man.
The cuff on? Okay.
Yeah.
All right. Good 25 mics fentanyl.
Yeah, cross-check 25 mics of fentanyl
25
for
mics
pain
fentanyl. 25 mics fentanyl in, guys.
and flush.
and flush.
250 challenge is still going.
250 challenge going. All right.
They're cycling blood pressure.
We're going to maintain relative hypotension.
Back is killing me.
Or I guess we could put them on an entitled cannula under the non-breather.
Let's do it entitled. Did we ever switch to a non-rebreather? Or a non-rebreather and entitled?
Yeah, non-rebreather, 15 liters, and entitled nasal cannula. Okay, yeah, that looks perfectly fine to me.
All right, that'll help us monitor perfusion,
so-
breathing 16 times a minute.
Okay, so let's start over. Generalized weakness, nothing over the past couple of days. History of metformin, center probe lipitor.
History of hypertension, that would always.
History of hypertension did head
Yeah,
to
like-
normal.
The cuff keeps sliding off on this left arm. You want it? You want me to put it back on tighter?
I'll take a look at it. Why is that cup sliding off?
Because I can't. I don't know. I'll make it tighter here.
Let's do a stroke screen real quick.
Yeah.
Just to make sure.
Yeah, just, I mean,
All right, that left arm was 141/87. Has the pain improved with the fentanyl management? Let's do a repeat on the other arm. We keep alternating arms between blood pressures. All right, dopamine is prepared if we need it.
My back is killing me, man.
where's it hurting on your back? I'm going to palpate his back and take a look.
Like, oh, right there. It hurts. It feels like that movie Alien, or not Alien,
Predator.
Spaceballs.
Would you describe it as a ripping or tearing pain?
I don't know what I would call it.
Okay.
Is it pressure?
I call it as like a bad pain,
Bad pain on a scale of 0 to 10. How bad is that pain?
like a shit ton.
A shit ton?
I want to
I
clarify.
think that's two above 10.
Blood pressure has been trending up. We have not started the dopamine and has not been administered. I just want to make sure.
That's on the left arm. You want the other arm?
Yeah, I just want to make sure you guys didn't think we started the dopamine. We just had it prepared.
No.
Okay.
Okay. All right.
It'll be on your right arm.
The next
Right.
one's right arm. Okay. So that
This
170.
Lightheaded.
One more time, bud.
I feel like lightheaded too.
Blood pressure keeps trending up because we got to keep in relative hypertension. The rest of it cause that
You want to call med control, see if they have a preference between Esmol versus Laidlaw.
Yeah, we can ask them. Yeah.
Contact med control real quick and have a request.
Medic 30, this is medical control.
Yeah, University Medic 30. We've got same guy we called in earlier. Left arm systolics in the 170s, right arm systolics in the 140s. Complaint of mid-clavicular,
10 over 10.
10 over 10.
Back
Pain.
pain still. We're
back
considering if you have a preference between Esmolol or Labetalol. His right arm blood pressure was 86 over 54, but his left arm is 171 over 86.
Given your short ETA, I'm comfortable with whatever medication you're able to give the fastest right now.
Okay.
So
All right.
Esmol is going to be bolus for Esmol in that 30-second push. I think, correct?
What's our dose again?
Yeah.
I know Labetalol 10.
So, hey man, how much do you weigh? Bolus
What's
is 1 kg. How much do you weigh?
Like 230 or 230.
230. You want to call him 220 for easy math?
I'll take the weight off. Thank you.
You'll take it off? Okay.
Yeah.
All right. So we'll go with 220. We'll call him 100 kgs. The bolus for Esmol is going to be 1 milligram per kg. So 100 milligrams. Do you even have that much in the thing?
Yep.
Yep, we got plenty. Yep. All right, so we're going to pull that. That is going to be a 30-second push cross check.
All right, let's keep vitals going between each arm every 5 minutes. We're pulling the
So we did-
Esmolol up at present.
Yeah, so we did a BGL. We did a quick head to toe. Did we check behind his knees? Do we notice anything on his calves?
This is your left arm again dialing up.
No, so left is running now.
Man.
You guys arrived at the hospital, so we'll stop there.
All right, well, Esmolol is being pulled up.